Hi, everyone. I'm the director for our New Zealand registered not-for-profit called Common Knowledge. And we've been privileged since I set up the trust in the mid-1990s in New Zealand to carry all of the birthing better skills that I and hundreds of fathers and mothers developed in the United States in the early 1970s. It was a really magical time in the United States then. The very first childbirth preparation classes were being taught. They were entirely skills-based, Lamaze and Bradley. Lots of issues. The skills were, it was just the beginning evolution of a concept that we should be skilled. Sadly, they were focused on low-risk women, and sadly, the skills were not sophisticated enough to adapt or adjust or be sustainable. And the philosophy behind it wasn't for 100% of pregnant women. And so that was a mistake. But when I gave birth again in the 80s, the childbirth classes were now childbirth education classes. Skills were no longer taught because very famous people were saying, cows and cats aren't taught, humans don't need to be, women have always given birth, we of course know how to birth. No, we don't know how to birth any more than we know how to be a good lover just because we're horny or know how to cook just because we're hungry. We don't know how to birth. We will birth because we're biologically mandated to do it. And by the way, having a non-laboring cesarean is still birthing our baby. And you can use skills no matter how you give birth. So when we started to develop the birthing better skills, as fathers and mothers, we were doing two things. We were looking at birth from the viewpoint of us, women, doing the activity. And back then, 95% of us were laboring. That wasn't necessarily good or bad. Some of us labored for hours, others labored for days. Many of us suffered, others of us coped well. Most of us, vast majority of us, had good outcomes. Some had tragedies. Risks, which there are heaps and heaps of them, are normal, natural, and physiological, and thankfully very few of them become problems. And most problems self-resolve or can be resolved within the healthcare system. Very few tragedies come from risks that are either known or unknown, but they do happen. And that was considered to be unfortunate but accepted. Medical profession didn't have the sophistication of identifying risk factors. If women had Rh negative when I gave birth in the 70s, there was no ROGAM. So if your baby was Rh positive, you had an issue. That baby could have a serious issue. Women didn't have birth control back then, like they did in the 80s. And so we weren't limiting our families. Women weren't also in the workforce as they are now. And so we wanted to reduce risks, and we were more likely to have more medical care because we wanted more medical care. But this is about re-envisioning childbirth because I grew up, I've lived so long that I've lived through three iterations of the childbirth conversation. First one in the United States, which is not global, was everybody should become skilled, but the skills are focused on low-risk women to achieve a natural birth, pain-free labor, yeah, go figure, and no medical care, go figure that as well. Then the trend in the 80s became all medical assessments, monitoring procedures, or interventions, they're imposed on you. Make a birth plan, you know what kind of birth you want. Tell the people that you've hired to give you the birth that you want, and that's how we should do it. That's a choice-based trend. That's terribly failed most people. So now here we are now. I'm 77 years old. Yeah, think. So we have to re-envision childbirth, and this is what I've carried forward for 50 years. And the vision is very, very clear. It should be just normal and natural when you're pregnant to learn some birth and birth coaching skills and use those skills while you do the activity of birthing your baby. We have to do it. Women do it by themselves. If we're on our way to the hospital, being prepped and lying down to have surgery, we are doing the activity of birthing our baby. And if we are going to be skilled once our baby is born, our baby is here now. From the moment we conceive, our baby is with us. And we can put skills in place to work through the activity or the living through pregnancy and the activity of preparing for birth, which is this massive gateway experience that moves the baby out of our body into our arms. And fathers or others who are seeing us and participating, they can help us. And what do they want to help us do? primarily to cope and to manage and to work through, to deal with, to handle, to stay on top of, to feel in control. We don't like to feel out of control. And birth is such an infrequent, one-off experience that can't be replayed, that's life-transforming. The memories live with us forever. Don't you think that we, as women, would have recognized the importance of being skilled? But not true. Women absolutely, and some famous men, absolutely rejected the concept that we need to be skilled to do this. Although, curiously, they believe we have to be skilled to know how to breastfeed, right? It comes afterwards. Go figure that one. So we need to be skilled. This is a concept, single word, different iterations of this single sentence, different iterations of it, easy to roll off your tongue. When you're pregnant, learn some skills and use some skills to work through the activity of birthing your baby. Okay? It's simple as that. So pass it on. We have a responsibility to each other at this point to pass it on. I can't do it alone. I haven't been able to do it alone for 50 years. Can we get midwives and childbirth educators and doulas and those advocating natural birth to pass it on? They have to change their attitude, because their attitude is that women have always given birth and we know how to do it. And women should just be left alone to discover birth. And midwives should sit in the corner and knit. And you shouldn't tell women what to do. Fathers shouldn't coach. So if they have that attitude, they do not understand the concept, which is 100% of pregnant women are going to give birth one way or another. Each woman has to do this activity with her baby, and we should be highly skilled to do an infrequent, one-off, life-transforming activity that memories last a lifetime. So we need a new concept of re-envisioning childbirth. So today we're going to talk about relaxation. Why did Birthing Better Families develop so many skills? We develop skills because there are many aspects of what happens when you give birth. You have to do this activity moment to moment to moment to moment. And although driving a car is not a physiological experience, we have that same experience while driving a car. We have to learn a complex set of skills. We don't learn them linearly. In other words, we don't learn A first, and to learn B, you have to have learned A, because the steering wheel and the foot on the accelerator are not the same things. So breathing and relaxation are not the same things. But we have to learn a complex set of skills to drive a car. And then every time we get behind the wheel of the car, when we go on a journey from A to Z, we are expected by society to apply those skills on a nanosecond basis. Not only what we're doing in the car, but paying attention to everything around us and how everything around us is affecting us and all of the things that we're feeling in our own life. So if we've just had a fight with a kid and we get in the car, society does not expect us to take road rage with us. That should be how it is with childbirth. We have to learn a complex set of skills that are not hard to learn because they're part of our body. So if I do this, you can see I'm tense. So if we're talking about relaxation, your response to me would be relax. Well, if I'm feeling a lot of pain because I'm taking this temporal journey, birth starts here and it ends there in time. I may not go anywhere. If I am doing this and you tell me to relax and I'm feeling a lot of pain and I glare at you and tell you to shut the f up, or you try, or I'm trying, it's hard because we're feeling pain. But does relaxing your shoulder make one bit of difference to your baby? And the answer is no. You have to relax on the inside of your body, because that's where this big object is coming out. And this is why men were so important in developing birthing better skills, because they see birth from the outside. And they see this big belly. Right? They know this big object is coming out. Women, we have some sort of a shutdown about this. Okay? And I always thought that it came from seeing cross sections of bellies. And you look at the baby, it looks like a big object. And then when you find the birth canal, it looks like this tiny little tube. And so what I think women think is what I call the toothpaste effect. Get a big object inside, you go into labor, this big object, the head compresses down until it's this big, it squirts out of us and then pops up to that big. Not true. That has to come down, has to open our cervix, come down through our bony pelvis, and then come down and then out our vagina. So go figure. If you're tight, which we were taught, which you may still be taught, pelvic floor exercises, Kegel exercise, hold back your pee, tighten up down there for strong pelvic muscles. You don't want them for birth. You want them for after birth. So at 6 months, stop doing that and start softening. Pick it up after birth. You're pregnant infrequently, so you can do that for years and years and years. You do not need strong muscles to push your baby out. You need to be open, pliable, flexible, mobile, soft. So how do you soften? We soften inside. Most of us don't know how to soften inside. Why should we? How many of us need to? When do we use this? It can be very specific. When do we do this? Only when we drive a car, right? When do we put our foot on a gas pedal? Only when we drive a car. So it's okay to have skills for a specific task. So there are 4 types of tension that birthing better families. Conscious, that. Subconscious, that. Don't even know you're doing it. Okay. Structural. So I'm working with a man now. He cannot open his arm all the way because he does a lot of this kind of stuff. He doesn't do a lot of that type of stuff. It becomes structural. You can have that structural tension inside. When you do the internal work on birthing better, and your partner does it or you do it, you can feel tight places. So soften those tight places. It's structural. Right? Stretching tension. How many of you could just do a split right now? Not very many of us. This has to come down through and out us. What's the ring of fire? That's stretching tension. Can we do anything about it? Absolutely. Soften up that tissue. The vagina, it's with massage. For 5 minutes for 8 weeks. Does that take a lot of time? Well, I have people all the time say, I'm too busy in pregnancy. And I go, are you going to be busy once your baby's born? No, 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 no. But your baby's here now. That's why re-envisioning childbirth is so important. Your baby is here now. And if you do not learn skills, if you do not use skills, employ skills to prepare your body for birth, and you don't use skills to do the activity of birthing your baby, then too often women then have to parent feeling disassociated, disengaged from what they just did. We have to stop that. And we have to stop it women to women. Because over the years, this is what I've learned. In my generation, the 70s, we all felt pretty good. If we had a tragedy, it was a shame. But multiple millions of us were using the inefficient, but their Lamaze and Bradley skills. They didn't always work, but we had something, and our husbands were helping us. It was something. Good place to start. Then, when I gave birth last in the 80s, very few skills were taught. So labor and delivery nurses and obstetricians stopped seeing 7 out of 10 skilled families. Started seeing 1 out of 10 skilled families. But we're all making birth plans and telling them we want 100 of things and we're going to be disappointed if they don't give it to us. Well, that hasn't worked. So to bring back skills, we have to understand that it's an activity. And part of that activity is learning how to soften inside our body or to relax inside our body. So how do we do it? Well, Birthing Better Families found out that when women in labor were doing this and a well-meaning partner said, relax, women would glare at them or say, shut up, or I'm trying, or you try, because they're feeling pain. So we learned that our bodies don't respond well, our minds don't respond well to the word relax. So we had to find another word. And we had to find a word that crossed over in all languages. And that word is soften. Just soften. That's just a general word. So in birth, where do we need to soften? We need to soften in our pelvis. Most of us don't know we have 4 bones in our pelvis and they all can move. Birthing better, the body work in that has the hip lift so you can move space between the hips sideways. Sacral maneuver in Kate's cat is to be able to move the sacrum, which opens up either the inlet or the outlet of the pelvis. And there's a bone the baby pushes out. Sit bone spread, which opens up the muscles that run from the rectum to the sit bone and from the bottom part of the sacrum to the sit bone. We can open up our pubic arch if it's narrow. We can open up our tailbone if it's long and tucked under. We can do the internal work. We can do all these things now. And yet, if we feel pain, if you just, without even tensing up down there, just hold down there, almost like I hold my head like this and I can't move it. You don't see me tensing up like that. I'm just that, can't move it. Because I've tensed up or held still my connective tissue. And then I have to let go. And what's connective tissue? Oh, it's that stuff between the skin and the chicken. It holds our muscles to the bones. It covers all the muscle fibers. It's our ligaments, our tendons. It's our skin. It's all of us except for the hair, the teeth, the bones, eyeballs. It's all over us, inside and out. It's our structural framework along with the bones that we have. But it stores memory. So if I just hold my connective tissue here, can't move, okay? So I have to just soften. You don't even see the difference. Hold, soften. Don't even see the difference. But the baby can feel the difference inside. Because people say, well, if my baby's stuck, I need to create space. No, you don't. No, you don't. No, you don't. No, you don't. Pinch. That's tight. Can't slide. Soften. That's unstuck. You didn't even see that. Okay, little bit, pinch. Okay, so I can just do that. Little bit pinch, can't move. Soften. Can't even see that. But that's inside us. That difference is that difference. One can't, can. You have to create that can. So this is what we learned, okay? Soften inside your right hip. Soften inside your sacrum. Soften inside your left hip. Soften inside your lower belly or inside your pubic bone. Now you did that. Now think about it. Just tense up a little bit in there. Just make a little tension in there. Okay, now you know how little you need to make. So start again. Back to square one, okay? All right. Now let me repeat it. Soften inside your right hip. Soften inside your sacrum. Soften inside your left hip. Soften inside your pubic bone. You can't do it. Why can't you do it? Because it takes the message from our mind to go into our body and for our body to react. How do I know when to pause? Because we all do it the same way. This is what we as fathers and mothers discovered. So if you're working with relaxation and your partner says, soften inside your left hip, they're doing it themselves. Soften inside your sacrum, they're doing it themselves. Soften inside your right hip, they're doing it themselves. Soften inside your lower belly and inside your pubic bone, they're doing it themselves. Which means you now have a common language. So just remember, relaxation, we need to use the word soften, and we need to be specific. Let me ask you a question. Where is your baby going to need you to be soft? Here or down there? So if I'm here and I've softened inside my right hip, I can still hold my shoulders like this or grab really hard. That doesn't matter. But if I'm soft here and tense down there, which you can do right now, that matters a lot. So this is what fathers and mothers figured out. So I'll keep going on re-envisioning childbirth, but you need to promise me you are going to pass on this concept that it's normal and natural when you're pregnant to self-learn birth and birth coaching skills and use those skills to work through the activity of birthing your baby. No matter where you birth, who's present, your circumstances, beliefs, choices, lack of choices, change of choices, or what happens to around you. You're the only one doing the activity. Thankfully now, there are more skills-based methods. There's still Lamaze, there's still Bradley, and they work fine for some people. Grantley Dick Reed, Birthing Better, Hypnobirthing, Hypnobabies, Calm Birth, Birthing Within. How many more do you know that are skills-based, not information-based? Just choose one or more of them from 24 weeks. Yes, it takes a while to learn the skills, and your mind is aware you're going to give birth within 16 weeks. You have a little bit of time. You don't feel particularly rushed. Gives you time to learn and to integrate skills when you can't practice something beforehand. But you can always envision it. You can imagine, I'm going for the next hour to be doing a labor. And then just every 3 minutes for a minute, apply some of your skills. Apply some of your softening skills. When you're walking, when you're taking care of your kids. And men, apply them as well. Because when you feel them, you can help direct your partner. Okay, see you later.